If you have an interest in horses and love learning more about horses, the horse industry, teaching, or even managing your own horse business, then you're in the right place. We would love you to join us on our mission, which is to improve the lives of horses around the world through the education of riders, handlers, and trainers. So get comfortable, listen in, and enjoy.
All right, at Horse Chats today, we've got back Dr. Raquel Butler. So Dr. Raquel Butler's a vet. She was in vet practice for almost 10 years, and she's been specialising. We'll talk a little bit more about that with Raquel. But before we do that, I'd just like to remind you that International Horse College, or Tech Academy, was born out of a need to improve safety in the horse industry while considering the welfare of horses. So if you're a horse person who holds these values and you'd like to gain government-accredited qualifications within the horse industry, then have a look at the wide variety of flexible course options at internationalhorsecollege.com. All right, now, Raquel, are you there?
Yes. Hi, Glenys.
Oh, great to talk to you. It's been a little while.
Yeah.
But today we're talking about the horse's fascia, okay? I just want to go through that. Now, we've talked to you so many times before, and you did about 10 years or almost 10 years just as a general practice vet before you really specialised, didn't you?
Yeah, I did 10 years in mixed practice and then went into bodywork for animals, so qualified in biomechanical medicine, which was chiropractic, osteopathy and rehab, along with a number of other therapies like muscle release therapy, kinesiology, taping, and had my own business in that for 7 years. Well, I still have my own business in that, but I've been teaching at Charles Sturt University for the last 4 years. That's my background, but I have my own business, Integrated Veterinary Therapeutics.
And I think you do some work with Sharon May Davis as well, don't you?
Yeah, I've been a vet now for nearly 20 years, but I was a vet in mixed practice for 10 years before branching into bodywork, so branched into muscle release therapy or bone therapy, and then qualified in biomechanical medicine, which is osteopathy, chiropractic and rehabilitation for animals, and then developed my own business, Integrated Veterinary Therapeutics, treating dogs and cats and horses full-time in bodywork for 7 years, and then started teaching at Charles Sturt University in equine science. And Sharon May Davis, she's been my amazing mentor along the way. She has taught me a lot about anatomy and biomechanics, and I've got to attend, I think, nearly 20 dissections with her. So I've been very lucky to assist her in dissections in Australia and overseas. So very, very, very lucky.
And I think, she's certainly got a great name for the dissections and the details
Absolutely.
She goes into. And I think if anyone has a chance to attend one of those, certainly just jump in and just go, I'll do it. Yep. Now, before we'll get started, because we're going to talk today about the fascia. Can you tell us, what is the fascia? What part of the body? I know we talked about the hyoid, and before, when you first sent me through some information about the hyoid, I had to go and have a look. I had to have a look and see where the hyoid was. So tell us, what is the fascia?
Yeah, so fascia is something that, as a vet, I didn't think was important at all. Wasn't something that we discussed throughout vet school. It's just something you cut through to get into the deeper layers of surgery. But it's a multi-dimensional dynamic, what we call a tensegrity structure, which I'll explain in a moment, that covers and invests into all the muscles, the organs, the nerves, the blood vessels, surrounds the bones, and it creates an interconnection throughout the entire body. So what do I mean by tensegrity? So tensegrity allows the body to balance the bones. So the bones are kind of held up in a state of compression in all dimensions, through the balance tension that's created by the fascia. So the fascia is kind of keeping it all together so that our bones don't just collapse into compression, because then we wouldn't be able to have all of the different mobilities that we and the horses have. So it allows for the expansion and compression in all dimensions when it's working optimally, so that all the forces can be distributed throughout the body and they're not getting kind of blocked in a certain area. But if there is a blockage in the fascia, so it might be from an injury, or it could just be, say, a spinal restriction or, perhaps some inflammation somewhere, then that's going to interrupt the flow of the forces through the fascia and through the body, and that's going to end up in other restrictions, compensations, and then set up for like potential injury. And it will break at its weakest point, because the energy needs to flow throughout the entire body for everything to work optimally. So, yeah, it's a pretty important structure, and they now describe it as an organ in its own right, even though, we think of organs being in just a specific area, but this one is covering everything. So it's very important.
So what's it actually made of then?
Yeah, so fascia is made of actually 90% water, which is quite amazing considering its strength. And then the rest of the composition is collagen and elastin kind of microtubules, an extracellular matrix that is between the cells of the fascia. So there are cells in fascia, and they're called fibroblasts. And those cells make the collagen and the extracellular matrix. And then also within that extracellular matrix, around the cells and the collagen and elastin microtubules, it contains what's called a ground substance, other proteins and ions that promote the absorption of water. So water and hydration is really important for fascial health. And then there's many different types of fascia actually throughout the body. So it's not all the same in its thickness, in its elasticity. It has different kind of collagen, cellular and extracellular matrix compositions within the fascia. And one of the thickest areas of fascia in the horse is actually over their back, which is really important because that's obviously where we sit. The other thing is that fascia has actually been identified to incorporate nerves and receptors that contribute to body awareness and proprioception. So it's not just a structure that's covering and sliding across all the things that it attaches to, but it's really important for body control and awareness and feedback to the brain and to the structures that it's surrounding.
Sounds like it's going to influence the function of the horse. Is there a connection between the fascia of different areas that would influence the function of the horse?
Yeah, it's so important in the function of the horse. So important, and especially, with all of the internal and external influencing factors, which we'll get onto. But so Ricky Schultz and Vibke Elbrond have written a couple of papers now on fascial lines that they've dissected out. So they've dissected 10 lines. The deep and superficial, deep and dorsal and ventral lines, so these run across the top of the horse and along the bottom of the horse. Then there's the functional line, which has a connection from the inside of the shoulder, and it kind of wraps around the hind end and comes back to there. And then the spiral line, which actually has 3 crossings over the body. And the protraction and retraction lines of the forelimb, which are basically what allow movement or, promote movement of the forelimb forward and back. So when that's restricted, those lines can be restricted. And those fascial lines are really important because they actually have connections. They show through dissections the connections from the front to the back. So, for example, the dorsal line goes from the back foot all the way up through the hamstrings, over the back, through the neck area, and it ends behind the eye.
Wow.
So
wow.
It's quite amazing that we've now been able to show these connections physically through dissection, that the hind foot is connected to the jaw, for example, and how important that is. And then the fact that some of those lines cross the body multiple times means that you can get restrictions where the body is quite twisted. And I was treating a horse the other day where I was working on the hind end, and he was holding the head crooked, and I didn't touch the head. I just worked on the hind end, and the head straightened up. So that's the importance of understanding those connections. And in some of the dissections with Sharon, we've seen some of these fascial connections too, say from the hoof. So she'll show a demonstration of the fascia attaching into the frog of the front foot and going up the forelimb, and then how that fascia through the forelimb is connected to the brachial plexus, which is actually the nerve plexus that supplies all of the nerve function for the forelimb. So having a healthy hoof balance and the way that that hoof is interacting with the ground and in motion is going to influence like your whole kind of forelimb function through the fascial connections, let alone, you know, where the saddle is placed and all of that stuff. So yeah, the connections are quite amazing.
What I love about this, Raquel, is that you don't just talk about the subject. You've gone into so much detail there. So, you know, it's not sort of just a passing phase. I think you're just an artist at what you're doing. You know, you're going into so much detail.
I've been lucky to learn from those types of people.
Oh wow, yes, but you've still got to want to do it, and I think that's important to recognise that. Yeah. Now, the fascia obviously affects how our horses move, but can you just go into that area a bit more and just explain how does the fascia affect how our horses move?
Yeah. So if we think about some of those connections, you know, that I've been talking about, then if those connections are restricted. So, for example, the dorsal line, the top line is the easiest one to imagine because we see a lot of horses where, you know, they're a little bit swayed back. And so those horses, so if you just, you know, stand yourself in a position and you hollow out your back and then you think about, say, trying to lift your hind legs or your legs and then thinking about trying to engage them or reaching forward with the nose, you can feel in your own body how difficult that is, let alone with a rider, you know, saddle, whatever other gear on your body. So horses that have a really contracted dorsal line, they often will be spooky because they're struggling to have kind of normal motion. They can't respond in a normal way, so they'll be a little bit more reactive. And they can just find certain movements very difficult. So you've always got to keep this in mind. You know, if your horse doesn't have an optimal posture, then they probably have fascial contraction somewhere and how that can influence their behaviour. So we've got to be very careful with you know, how we describe our horse's behaviour and how we attend to those problems. But any kind of fascia that's tight or dehydrated, so, you know, sometimes you look at horses and you can see the muscle lines. Like you can see the definition of the muscles. Well, in a horse with like really healthy fascia, you will not see that definition.
Okay.
So
it's an important thing to notice then, yeah.
Yeah, it's really important to have a look at your horse and see which muscles are kind of poking out and why is that the case. Because if you see horses that have been, you know, well maintained, they're doing good work and their fascia is really healthy, they'll just be like a fluid, smooth, balanced, and they'll generally be quite a happy horse as well. So you're looking for that. That can indicate dehydrated and tight fascia. Sometimes you'll get it for other reasons, you know, like there's lots of insects around at the moment. So the flies are making them twitch a lot and you'll see muscle definition due to that and tight fascia due to that. The other kind of aspects of it, so I have a horse that's staying with me at the moment and he has a potential underlying muscle problem. And what I notice with him is, you know, his fascia gets tight, his hoof balance changes in a day, which is crazy. But the way that he's standing on his hooves, if his muscles and his fascia are tight, it changes that interaction of his hooves with the ground. And then when his muscles and fascia are nice and hydrated and soft, then his hooves sit in a completely different way with the ground. His posture, his whole posture is changed in that instance. And so that's all a part of fascial tension. So we've got to think about, and I don't know if you're familiar with equine documentalists, but like he talks about the relationship between the feet and the body and how that's all interrelated. And fascia is a huge, huge part of that.
Okay. Now I'm thinking, you know, because we often talk about variation in training to change a horse's muscle structure, but this is obviously the fascia. So how can the variation in training help the fascia?
Yeah, so variation in training is really important. And, you know, we often get stuck as riders kind of really focused on our discipline and If we're doing dressage, we end up doing a lot of dressage training, or if we're doing jumping, we end up doing a lot of jumping. And for the health of your horse's fascia, it's really important to have variation. So fascia loves variation, and it thrives on having different types of movement. It really promotes that health. And one of the things that fascia doesn't respond well to is immobilization. And that doesn't mean just horses standing around. That can mean like your horse doing a certain movement, a lot of times in the day. So other areas are immobilized even though, some areas are moving. So it's not always the whole body immobilized. It's like certain areas might not be moving because of the exercises that you're kind of sticking to.
Yep.
So some examples of variation are like if you have a jumping horse, then, if we just jump all the time, and I've actually seen this in my clients' horses where, they'd get very kind of straight, but in a not supple way. So they're like very straight and they actually lose the ability to laterally flex. So they can jump the jump, but they don't have suppleness and flexibility. And in time, they can end up with problems due to that. So having a jumping horse doing flexibility exercises. So it might be a little bit of lateral work. It might be your stretching that you do on the ground. It might be some in-hand work that you do before you get on, which I'll talk about. For a dressage horse, it might be doing some gymnastic jumping, which creates a rebound effect in the fascia. It also, horses should have, some hacking out and just some kind of long, easy kind of work, and that promotes lengthening and hydration. I've talked about the lateral movements for flexibility, and then incorporating stretching in your routine, and we'll talk about that, and different types of stretches. Bodywork is great for helping the fascia with variation, and hydration breaks, which I will talk a bit more about because that's probably super important in fascial health. But yeah, just don't get stuck in training the same thing every day. Like really think about, okay, I'm going to have 1 or 2 jumping days. I'm going to have a dressage day. I'm going to have a hacking day. And then, you might have another kind of training day in there specifically. But giving them kind of that variation throughout your training week and planning your training plan will be extremely helpful.
Okay. And what type of stretching and mobilisation would you recommend? Can you go just into a little bit more detail here?
Yeah, I think the important thing is to make sure that it's designed for your horse, because some horses have a tendency to be stiff. So if you've got an older horse, so as fascia ages, it becomes less mobile, it becomes more stiff, and it loses some of that elasticity. So if you've got an older horse that's stiffer, you're going to want to have stretches that promote more gentle mobility, making sure that you stay within a comfortable range of motion. If you have a horse that's, say, hypermobile, which, some of our warm bloods these days are, then you're not going to want to hold stretches for very long. You want to make sure that everything is moving in a balanced way, but you don't want to overstretch them because you actually don't want to promote more mobility in their fascia. You want to promote not stiffness, but you want to promote strength in their fascia. So you're going to do a different type of stretching for that type of horse. But as a general kind of rule of thumb, before work, have a bit of a mobilization plan, like how do you warm your horse's fascia up? So it might be that you do 5 minutes in hand before you hop on your horse, mobilizing their shoulders and hindquarters, doing some lateral flexion of their neck and other kind of spinal opening moves, so very gentle kind of belly lifts or pelvic mobilizations. And obviously you need to work with a qualified body worker to make sure that you're doing those correctly. And then after work, when the horse is warm, then you can promote more lengthening of the fascia. So you can have a little bit more holds in the stretches. Like generally we say not more than 30 seconds unless there's a specific reason that you want to lengthen a muscle. But the great thing about stretching after a session is that you leave the fascia, so even if it's become a bit compressed and stuck, throughout the ride because they've had quite a hard workout, then doing some stretching after your ride, especially once you've taken the saddle off and everything, you can leave that fascia in a much healthier place. So then the recovery is much better for the horse. So then the next time you get on, you've improved from the time before because you left the body in the best possible place. And the other thing is make sure that you give the horse time between the stretches. And I'm going to talk about that, but it's not just the stretch itself that's important. It's also the breaks in between.
Is that the hydration breaks?
Yeah.
Yeah. Do you want to talk a little bit more about that? You know what you mean by the hydration breaks?
Yeah, so the hydration breaks are time for the fascia to regain any water that's been squeezed out due to the compression. So it might have been compression in stretching, or it might have been compression in the work that you're doing. So sometimes we get on our horse and then we ride it for like 40 minutes, and the whole time, we're asking them to do things, and we don't often think about the fascia and that it needs time for hydration. So that could be that in a young horse, for example, when we're conditioning the back to take a saddle, what we really should be doing is hopping on for 5 minutes, doing whatever we do, and then hop off for 3 to 5 minutes. So we're actually giving that fascia hydration breaks without us in the saddle, because it's still strengthening and learning how to take the load of us. So that's how we can help young horses. And in that break, you might be walking, you might do a couple of little gentle stretches or some mobilization, so you really help that fascia to move. In a more conditioned horse and a more, say, high-level performance horse, it might be that you do, a few steps of passage or piaffe, but then you kind of go out into just a nice, stretchy, easy trot, letting them and sit up off their back a little bit and let the fascia hydrate that way, because collected work is obviously creating a lot of compression in the fascia. So, yeah, it's not just getting off, it's not just stretching. It's like, what can you do within your work session to give the fascia a hydration break?
And with that hydration break, you said about just with the young horse, about getting off their back. Do you mean like getting up into 2-point seat to get off their back, or getting off completely?
In the initial stages, getting off completely. I don't think that we do enough of that. And even a horse that, has been out of work for a very long time. So as they progress, then just getting up off their back. But even getting up off their back, they've still got to deal with our weight through them. There's still going to be pressures coming from them, our distribution of the weight. So yeah, actually getting off and using a mounting block to get on and off, so that you're not putting extra strain on the horse's spine, especially when they're young and growing.
What's really good about the mounting blocks? It's like, when you're young and fit and agile and you can get on without a mounting block, you just do it. But when you're older, you say, oh, no, I need a mounting block because I'm saving the horse's back.
Yeah. Yeah. Whereas we have to be able to use it when we're younger and realise we're actually still helping the horses back then.
Yes.
And
yes.
it's, even though we feel young and agile and springy.
Now, to do with body work, how often would you recommend body work? Is there like a certain type of body work that the fascia responds better to?
Yeah, fascia responds really well. And as I said, about the variation, so with, say, my fascia work, a lot of that is kind of a slow melting type of work. So fascia loves that type of really slow and melting release. Massage can be just good for generally stimulating the circulation and helping with that hydration as well. So, you might kind of incorporate some massage in there with some chiropractic. So obviously things like chiropractic by themselves are not going to be as hydrating to the fascia. So that'll correct, restrictions, which will ultimately help the fascia. But if there's adhesions within the fascia in other areas away from where they're adjusting, it's not necessarily going to have a direct effect on those. So that's where incorporating that with, say, some massage, some myofascial release. Bowen therapy is amazing on fascia, as is craniosacral therapy. That kind of is in a different way. And then some of your other tools, so like PEMF can be beneficial for the fascia, and cupping. I haven't used that, but I've seen some practitioners using cupping, and taping. There's specific ways that you can tape to help with fascial hydration, so that can be beneficial. And in terms of how often, it's obviously going to depend on the practitioners that you have available to you and your horse's individual needs and, you know, their underlying weaknesses, their workload, how well their equipment is fitting, your commitment as a rider. So like my really great clients, actually most of my clients, you know, they do their stretches in between. Like I can tell when I come and treat their horse if they've been doing their homework. Yep. And when they have been doing it, you know, A, it means that I can be more effective in my treatment, but B, it means that like they're maintaining their horse much better, so I don't have to treat them as often either. So, but yeah, I would say for a performance horse, at least every 4 to 6 weeks, having a bodyworker look over your horse, looking at the everything, you know, the fascia and the restrictions, the compensation patterns, and making sure that everything is kind of balanced.
Okay. Now, I do want to ask you what other factors influence the fascia, but can we talk about diet as well? You know, is diet important about that? So it's sort of like two questions there into one, but if you can talk about diet, and then if there's anything else that we need to know as well.
Yeah, so diet's really important in fascial health because of that hydration component, you know, and the water component of fascia. So the importance of salt. So every horse should be fed salt. It's not something that they naturally get in their diet, and obviously any horse that's working loses salt in sweat. So all horses should be supplemented with salt. A lack of salt will cause fascial tightness and dehydration. And then obviously having access to appropriate water sources. So it's not really a problem in Australia, but say in overseas where like the water freezes. So even though it's really cold, the horse still needs to drink. So some people have to warm up the water just because the horses won't drink as much when the water's super cold. It's not a problem for their digestion or anything. It's just they just don't, you know, they just might not like it as much. So that could be a problem, but even just making sure that ice is broken and that they have access to like good kind of quality water. The other thing is to consider, you know, are there any kind of feeds within their diet that could be creating inflammation? So some horses can't deal with, or most horses can't deal with high sugars and starch. That creates inflammation in their body, and especially if they've got any kind of underlying muscle disorders or Cushing's or metabolic disorders, you know, those things will influence the fascia. And, yeah, any kind of other dietary imbalances will, you know, so if your horse is just not looking right, the fascia is going to be affected. And we've got to remember that fascia covers all of the organs as well. So if the organs aren't right, the fascia is going to be affected and vice versa. So that's, with diet. And then with what other factors influence the horse's fascia, it comes back to, you know, the good old things that influence everything, but like saddle fit, obviously we're sitting on those fascial lines. We have a girth around the fascial lines. The latissimus dorsi, which comes down from the saddle area at the back of the forelimb to the inside of the shoulder, like that is involved in numerous myofascial lines. So if we're restricting that, I think it's involved in 3 of the myofascial lines. So saddle fit's hugely important. Rider symmetry and compensation. So, you know, are you getting treated? How is your fascia? Do you have fascial restrictions? Because that's going to influence your symmetry and your connection with the horse and what they're feeling through their back and through their fascia. And then I mentioned hoof balance. That's, you know, I talked about the connections to the hoof through the myofascial lines. But, yeah, hoof balance is going to determine posture, which is going to determine the tension through the fascial lines, and the teeth. So making sure that teeth are regularly balanced, it might be 6 to 12 months, making sure that the bit is fitting the horse and it suits the horse's conformation, because that tongue is, and I think I talked about this in the hyoid, the connection of the tongue to the stifle, but also through the fascial lines, that tongue is connected into the organs as well. So when you follow that fascia in through the heart and lungs and through the other internal organs. So fit is really important from that perspective. So yes, I think that covers.
Well, I think that we touched on a subject, but it just leads to so many other things and so many other questions and so many other areas of the horse that we need to know more about. So I'm looking forward to getting you back again. I think, there's always going to be more and more and more. Yeah. Now, if people would like to contact you directly, though, what's the best way? I mean, it's a bit hard with, lockdowns or even out of lockdown, if they're too far away for you to travel, is there something you can do? Can you help them online, do any online consults or anything like that? How can people contact you for anything that they need?
Yeah, so I have a Facebook page, Integrated Veterinary Therapeutics, so you can contact me through that, or probably the easiest way rather than call me is message me on my phone, so 0435 813 505. And yes, I am offering online rehab consultations, or even, just to discuss your training plan and how you could, improve that for your longevity and performance of your horse. But also if you have a diagnosed injury and you want to plan for that, or you just want an assessment of your horse and some help in setting up, some exercises to improve them, and I'm happy to collaborate. Well, I really prefer collaborating with vets and other body workers. So, even if you have a body worker, I can work in collaboration with them to help set up a plan. And and I also offer some in-person clinics when, COVID permits, in kind of anatomy and biomechanics and assessment. So for body workers, but also for horse owners. So, yeah.
So if there's a group of people, a group of friends or a club or something, there was a few of them and they'd like to get you, happy to travel for them?
Yep.
Okay.
I'm organising clinics at the moment. So we've got a few happening in Victoria and New South Wales and the ACT over this year.
Yep.
So, yeah.
Perfect. All right. Well, look, all I can say is that, you keep going deeper and deeper, and then you do something else, and then all of a sudden that's connected to that, and this is connected there. And, I think, love to get you back, Rachel. So I'm looking forward to catching up with you again sometime soon.
Yeah, thanks a lot, Glenys. It's great to catch up with you. Thank you.
Bye-bye.
Bye.
If you've enjoyed this chat, then please comment, rate and subscribe. If you'd like any changes or recommendations for guests, then please contact us through horsechats.com. And while you're online, have a look at the government-accredited courses at internationalhorsecollege.com. Registered Training Organisation 31352.
Remember that our comments and instructions are general in nature and do not take into consideration your individual horses or your individual ability and circumstances. If you enjoyed this podcast, then please leave your comment below.